Hi, I'm Dr. David Hill, and today we're going to be talking about sleep apnea and asthma in toddlers. Toddlers are at a particularly sensitive age for acquiring asthma. Rates of asthma are sort of on the rise in that age group as kids sort of grow into their asthma. So this is the first time in a baby's life or a child's life that you may recognize some significant breathing problems. Asthma may present very subtly, just with a cough, for example, especially a nighttime cough or a cough that occurs during exercise. Many parents come to me and say, my child only coughs when he gets hot or when she gets hot. How do they get hot? Well, they're running around. Really, that's an exercise-induced cough, and that should raise big red flags for asthma. Also, if you walk past your child's room at night, you hear coughing at night, that might be asthma. Sometimes the asthma symptoms are more dramatic. You may hear a high-pitched sound when the child breathes out. This is called wheezing. You may see the child struggling for air, working hard to breathe, not being able to say short sentences, or not even being able to tolerate exercise in some cases. That's really significant, and those sorts of symptoms need to be addressed immediately by a doctor. Sleep apnea can also be subtle. Almost always this occurs in children who are snoring, often snoring loudly. However, sometimes in the process of that snoring, the airway closes up completely, and the child's not able to get in any air at all for a little while. That child usually kind of blocks the airway and then wakes up gasping for breath, kind of, and that may happen dozens of times a night. Each time that happens, the brain is deprived of oxygen. This interferes with sleep architecture and may present with behavioral issues. In fact, some children whose parents or physicians think they have attention deficit disorder don't realize they have sleep apnea. Sometimes, if you fix the sleep apnea, the attention deficit or hyperactivity disorder also goes away. Untreated sleep apnea can cause serious conditions of the heart and lungs. So it is important, if you suspect your child has sleep apnea, to get some sort of assessment. Now, one assessment is called a sleep study, where the child actually goes to a special sleep lab and is hooked up to a variety of monitors to look at the child's heartbeat, breathing rate and rhythm, level of oxygen in the blood, and even brain waves to figure out what phase of sleep the child is in. This is the ultimate way to diagnose sleep apnea. However, sometimes when the history is very straightforward, we don't even really need the sleep study. Treating sleep apnea may involve surgery, tonsillectomy, or adenoidectomy, but often we start by trying to treat allergies using nasal steroids and other allergy medicines. So you're going to want to talk to your doctor about the best way to treat sleep apnea if you're afraid your child might have it. Talking about diagnosing asthma and sleep apnea in toddlers, I'm Dr. David Hill.